Hi, I'm Dr. Tammy Kondis, and today I'm going to talk about when you should bring your child to the emergency department versus calling your pediatrician or going in to see your pediatrician. But what are those true emergencies? Well, I would say the biggest emergency would be if your child is having difficulty breathing. If your child is struggling to breathe, they are gasping, they are changing color, their chest is moving out abnormally, just come to the emergency department. Another big thing that we see in the emergency department that would be considered a big emergency would be if your child has swallowed something that is concerning. So if your child has swallowed something like a medication or a drug, something small like a magnet or a battery that could potentially be very serious. Another big thing that we see in the emergency department is types of trauma. And most pediatricians' offices are not equipped to deal with things like lacerations or broken bones or other major trauma as well. So if your child has fallen and they are actively bleeding, or they can't move one of their extremities and you think there might be a break, just come to the emergency department. Another time you might want to come to the emergency department is if you think that your child is dehydrated due to an illness. So perhaps they have been vomiting quite a bit or having quite a bit of diarrhea, and we see that a lot with different gastrointestinal viruses. With any of these complaints, your child may not necessarily have to stay overnight in the hospital or be admitted. We can often treat them in the emergency department and then discharge them. But they're all things that we would want to deal with quickly and quickly give your child some type of medication or therapy. Maybe they need stitches, maybe they need a cast, and those are all things that we would be dealing with in the emergency department.